honor and glory. And to
Speaker of Parliament Anita Among says that the measures are guided by the Ministry of Health. She says every person who will access Parliament must wear a mask, wash their hands and have their body temperatures checked. Among says the entrance of non-invited guests will be restricted. She directed the ICT Department of Parliament to ensure that some MPs virtually participate in parliamentary sessions using their iPads.
The Minister guided on the need for strict observance for the following SOPs. Temperature monitoring of all persons entering to Parliament. And I think that has started. They are doing it. 2, consistent and regular hand washing and sanitizing. 3, restriction of physical presence of members in the chambers, and we agreed to limit the number of members back to 100 members of Parliament in the House. Those who exhibit symptoms similar to that of Ebola should be responsible enough not to come to the House.
This comes after opposition MPs in Parliament opposed the likely plan by the government to announce a lockdown in some parts of the country, especially Kampala, Wakiso, Mukono, to prevent the spread of Ebola. The Shadow Minister for Health, Timothy Batua, said that locking down some areas is not a solution to such a disease, but rather sensitizing the masses and providing personal protective equipment to medical workers.
We shall manage this disease. But if we keep looking at it at the level of a patient, yet transmission is at fluid level, we are missing a lot. COVID-19, as we were using masks, the game changer here will be gloves and condoms.
Apparently, Uganda has registered 129 accumulative cases of Ebola, 37 deaths and 43 cured, mainly in Kasanda and Mwende districts.
The Ministry of Health employing various interventions to mitigate the disease such that the disease doesn't spread far and wide. However, what we noticed so far is that the number that was first reported, which was a single-digit number, has now gone up to be a double-digit number. And as of the last conference from the government side, the number had risen so high to be a 3-digit number. What is important to note that government has not done is to specify the most at-risk group, which group of people is at the biggest risk.
Joyce Bagala, the Shadow Minister for ICT and Information, urged residents in the affected areas to stop exhuming bodies, to perform rituals on them, and those who are sick to stop consulting witch doctors and pastors because they could be suffering from Ebola.
We got reports that people run from Kasanda, people who are sick, run from Kasanda into Mityana through Chigalama and other gardens around because they're really near, and they go to witch doctors, which is really, really such a risk. And would like to encourage our people, if you find yourself with symptoms of Ebola, simply go to a health center. Don't go to witch doctors, or don't even go to church. What you need is to go to a health center